Last but certainly not least is Nancy Alderman, current president of Environment and Human Health Incorporated, an organization dedicated to protecting human health from environmental harms through research, education, and the promotion of sound policy in Connecticut. Nancy is a past member of the Governor's Pollution Prevention Task Force and on the board of directors of Environmental Defense. EHHI is made up of doctors, public health professionals, and policy experts committed to the reduction of environmental health risks to individuals. Its work focuses on pesticides, childhood obesity, cancer, asthma, school environments, wood smoke, synthetic turf, plastics, and more. And Nancy is a good friend as well. Okay.
I can do it in 2 minutes. I think one of the things about people who work on pesticides is they have a lot of endurance. So this is proof of their endurance. And the other truism is that you win it once, and you'll have to keep winning it over and over and over again. So anyway, I think that the reason I'm on this panel of 12 people, or however many number we are, is that I am meant to talk about policy. So I'm going to talk just a little bit about policy in Connecticut, policy in general. I do want to say that Patty and Doug would have enough energy for all of us in this room. And they not only do New York and have created New York as a model, they've taken over Connecticut, but in their generosity, they've also come into Connecticut and helped us as we work through our pesticide work. So I think I'm going to just start for a minute with Rachel Carson. And the reason I say this, I was asked about 2 years ago if I would, on Earth Day, give a talk about Rachel Carson and her book. And I don't know how many of you have gone back to read Rachel Carson. I hadn't. I mean, most people who do this work have read Rachel Carson. And they sort of think of her as, you know, somebody who has changed so much. If you go back and read Rachel Carson carefully, you will find out what we all know, which is how hard it is to get anything done politically. She got organochlorines removed. She got that. She got DDT and dieldrin and all the things, you know, removed. And in its place, we got organophosphates. But all the other things that she talks about are with us today. It's extraordinary. I mean, it's absolutely extraordinary. She talks about if you use pesticides somewhere in your community, they will show up somewhere else in your community, in your drinking water. The first thing Environment and Human Health ever did was to look at wells in Woodbridge, Connecticut, a bedroom town, had no industry. And we got 53 wells. And we divided the people into regular users, intermediate users, and non-users. And then we tested the wells for pesticides. And what was extraordinary about what we found out was that the person with the organic care of their lawn had the most pesticides in their well. They had 5 pesticides in their wells. So, in fact, what Rachel Carson was telling us back in 1962 remained true when we did this test in 1999. She also talks in her book about labeling. So, if you pick up a package of weed and feed or any other package that you all are never going to pick up, but if you were to pick one up, you would see the point that the label is in is like 2%. I mean, it's tiny. You can hardly read it. And then it says, you know, be careful with children, which is an even smaller type. So anyway, she talks about labeling in the book. So I'm just saying, I recommend to all of you who think you know that book to go back at it, look at it again, and see how much we are living with today that she talked about then. So now I'm just going to talk a minute about Connecticut and sort of what we're facing. So what we did get in 1991 was that labeling law, that law that gave us the tickets by your driveways that tell you when something was sprayed, and also the registration law, which you can sign up on, and everybody, your neighbors, have to tell you when they're going to spray. The problem is, you can only do that in December. People in December sort of aren't thinking about their neighbors spraying, so you can do it later, but you won't get the next spring and summer. So even when we get something, it is difficult. That's, I guess, all I'm trying to say. The Department of Pesticide, the Department of DEP, Pesticide Division, doesn't want a whole lot of people on the registry. It's hard for them to sort of manage that registry. So anyway, I'm just handing that out. And then in 1999, when we got the indoor bill law on what you could do on the inside of schools with pesticides, that has not been fought. That has held true. Whether the schools are actually doing what the law asks them to do, there's really nobody to go back and find out. So they're meant to keep, only a professional can spray in a school. It can only be done when children are not in the school, and they are meant to keep records for 5 years, and they're meant to use less toxic materials. That is the law. And you're meant to be able to sign up on a registry. So if you're a parent and your kids go to a grammar school or a middle school, you are meant to go into the school and be able to say, before you use any pesticides, would you please let me know? We sort of doubt that they are doing that. And then we moved to the law of 2005, which was really a landmark law at the time, which was the ban of pesticides on grammar schools or schools K through 8. And that that's been problematic from the day one that it was passed. So we got it passed, and they were happy to do the grounds, not the fields. They were happy to do the grounds. Schools don't have much grounds. They have fields. And the fields they weren't giving in on. And so the fields had to have 3 years of IPM before they would go organic. So, okay, that seemed all right, but then they kept pushing it back. We need another year. We need another year. And so finally, in 2010, the bill goes into effect. Organics are to be used in schools K through 8. Now, the bill went into effect in July. So all of us who know about spraying know that most of the spraying for turf takes place April, May, and June. So even though the law was in effect in 2010, they got to spray in 2010. So the real law goes into effect in 2011. And here we are, 2012, at the legislative session, and they're not happy. They are not happy at all. And so the industry, along with park and rec people and a lot of other sort of pesticide forces, are at the legislature in force. The other thing is, when we started doing pesticide work, the pesticide sprayers had the name pesticide in them. You sort of knew who they were. You knew who the environmental people were. Now, I mean, we've gotten better, but they've gotten better. So, they have names always with either green or environment. The word pesticide is nowhere to be found, so you have to know who they are. And, it's all gotten very clever and very difficult. So where New York is not having trouble, we are having trouble now in Connecticut. And I would only say, I think the reason is that Connecticut has been on the forefront for pesticide legislation for years. And I think they have simply gotten smart. And so, what are we to do? How do we manage? And I think we're doing a really good job. This was the first year that we put a preemption law in place, and we are the first state to have done that. And it's a lawn care preemption, only lawns. But that's a big deal because we have 41 other states that have pesticide preemption. And so if we can get it passed, that's a big deal. But I don't know whether this year we will get it passed, but we will be back. One thing about endurance, with you all sitting here through all of this, we have endurance. And I think that's what one needs when one is dealing with environmental issues. You can't go away. You simply can't. And the one thing also we've learned, and I find it really frightening, but in the work we've done, the more we study, the more we know it. And that is the bad news, that these exposures to fetuses, the prenatal exposures, are in many ways going to affect that child the rest of its life. And we didn't know that a whole lot before. And whether it's BPA, which one of the people on our group has done a lot of the major research, whether it's phthalates, whether it is, we have a brand new cell phone report out, whether it's pregnant women using cell phones, whether it is pesticides, whatever it is, the really bad news is that these things are affecting fetuses. And it was a much happier time before thalidomide, when we all believed, including the medical community, that that brain barrier, that placenta, it protected the fetus. And now, what do we know? We know not only that DES moved through, that thalidomide moved through, we are now finding in low doses, all these other things are moving through. And today or yesterday, we send out an email every day. And the one that went out, I believe this morning, was the rise in autism. But autism is a huge spectrum. I mean, it's not, it's a huge behavioral spectrum. But in fact, is it any surprise that so many children have behavioral issues? Is it any surprise? And so that's the bad news. So if we all have enough endurance, we need to keep going in spite of how many times we're knocked down. And we're knocked down, in my opinion, all the time. That's why I love my prize the other night. I mean, how often do environmentalists get a prize? I mean, really, does that ever happen? Never. So anyway, I thank you for your endurance, and I think that's all I have.